Hello. Hello. Welcome to another show of New Hampshire Citizens for Progress. It's that time of year again.
Yes, it is, Rick. It's the annual enrollment period for Medicare. So if you haven't had a chance to review your plans or take a look at what's going on, now's the time to do it.
Uh, you need to do this when are you having difficulty paying your medical bills? Do you know where? These funds are coming from? What do they need to do?
Well, so if you're in a situation where you've been injured, you've been hurt, you're disabled, and you've lost your job, you don't have any capability of paying your medical bills. One of the first things that we suggest you do is you actually contact the Department of Health and Human Services, and there are programs such as the Medicaid system, which can help people, cover your medical cost. That would be the starting point.
And they're the ones that would determine whether it's Medicaid or Medicare or what you might need, besides being old like me.
So in regards to that, so if you're pre-65 and you're not ready for Medicare yet, then you'd want to get in touch with the Department of Health and Human Services and apply for Medicaid. At that point, if you're unable to work and you're permanently disabled, then what you want to do is you're going to want to contact the Social Security Administration and apply for disability benefits.
So you make these policies available to people, and there's a difference between an agent and a broker.
Yeah, well, we are an insurance agency, and I'm what I refer to as an independent broker. So essentially what that boils down to is that I am not a captive agent. I do not work specifically for any insurance carrier. My job basically is I go out there and contract with every major insurance carrier in the state of New Hampshire so that when I sit with my clients, I can offer them all the available options with all the insurance carriers in the state of New Hampshire.
You know, I told people I was doing business with you, and they expressed, it was actually an agent, says, you got to be aware that they could be being paid different commissions, and therefore they might present information that benefits them more than you.
So that could be the case when you're dealing with a captive agent. They may have, some type of loyalty to the agency or the insurance carrier that they work for. That's the benefit of working with an agency that contracts with so many different carriers, because I don't have a loyalty to the insurance company. My loyalty is to my customers and my client base. My job is to make sure that I find them the best option that's available to suit their specific needs. Not so much, cater to the insurance carrier and trying to meet some type of, quota that, they've deemed upon me.
Yeah, I do want to say that I've been working with you for over a year now, and
Yep.
I found that you present all my options to me, and you provide the information so I can make a good choice.
That's exactly what we do. And the reason for that is because, I have, again, like I said, I have no loyalty in regards to being compensated. We're compensated by the insurance carriers, and the compensation is pretty much exactly the same. There's really no difference in the compensation schedule. So when I sit down with a client, it doesn't matter to me whether I enroll you in ABC insurance or XYZ insurance. We get compensated the exact same way. So my only concern is trying to make sure that I find the best program or best plan that's going to suit that individual's specific needs.
So people that are already on Medicare right now, this is the time of year that you change it. They have to do this by the December 7th?
So annual enrollment period starts October 15th every single year, and it gives you until December 7th to change your plan. So within that time, you can either review your options, okay, or you can change your plan. Now, there's not always a need to change your plan, okay, but it's always a good idea to check with your agent or your broker, whoever it may be, and review your plan, okay, make sure that you're still in a good situation and you're still in a good plan that suits your specific needs, but not necessarily a need to change it. Now, one thing I wanted to point out to you is that AEP is what they refer to as the annual enrollment period, which is October 15th to December 7th. What a lot of people are not aware of is that there's an OEP. OEP is the open enrollment period. Now that period starts January 1st and runs until March 31st. It gives you a 90-day window, okay, to change your Medicare Advantage plan only. You can't change a prescription drug plan, okay, but you can change the Medicare Advantage plan within that time period if you're not happy with the new plan that you've been enrolled in at the start of the year.
So that would be for, I get assistance because my income's low, so my pharmacy plan is through the same Advantage plan of the insurance carrier I have. That would have to be someone that had to purchase a separate plan for their pharmaceutical.
Right, so if you've got a prescription drug plan, okay, so either you have one or the other in Medicare. So either you have a Medicare Advantage plan, which includes the medical and prescription drug coverage under one plan, or you have a standalone prescription drug plan that does not have medical built into it. Now, you're allowed to change the medical and drug plan, the MAPD. You're not allowed to change the PDP during that open enrollment period.
So I called you a couple of months ago and discussed about what options I had. And I believe you were saying they haven't released this coming year's plans to me yet.
No. So what ends up happening is that as we speak right now, even though we're in the middle of annual enrollment period, they're actually preparing the plans for 2023. And so these plans are under, creative, bargaining, or however that you want to explain it. And then they go before the review of Medicare in the summertime, at which point in time Medicare gives the approval on these as of October 1st, and then we can start talking about them. At that very same time, Medicare is sending you out what they refer to as an ANOC letter. It's the Annual Notice of Change, and it's going to describe the changes of your plan going into the next year. So after October 1st is officially when we can start talking and discussing plans, but at no point in time can you enroll anybody into a plan.
This seems like a lot of information. You have to know who your doctors are, who your hospitals are, what medication you're taking. All these things can make one plan better for you than another, but there's not necessarily the best plan there is. It's what your needs are.
Exactly. So I have clients ask me that all the time. What's the best plan? There's no such thing. There's no such thing as the best plan in Medicare. Really what it boils down to is it's the best plan for you. Whatever plan suits your options. I call it the Medicare funnel. And first and foremost, we start with your prescription drug coverage, because typically that's the most expensive out-of-pocket cost right away with your medical plan. And then we look at the choices of doctors, hospitals, and networks, and then we look at the additional benefits that they talk about all the time when you see the advertisements on TV, and we kind of funnel it all the way down until we find the right fit for your specific need as an individual.
So to get the best services for you, this seems like a bit of work. You have other resources for people?
We do. We have a couple things. So first and foremost, we do one-on-one consultations with our clients all the time, and we also offer educational seminars free to the public at our Manchester office now every Wednesday at 2 p.m. and every Thursday at 6 p.m. And all we ask is if the individual would call the office to reserve a seat. We only have a limited number of seats there, at our office in Manchester, and it's free to anybody, and there's no obligation, there's no commitment, and just come and learn how Medicare works. We do not talk about insurance. We do not discuss plans. We do not talk about anything that revolves the insurance carriers themselves. We just teach you the difference in how all the Medicare options are.
I want to say that my viewers know that have been a union electrician, and I have a basic attitude that I like to buy things from my neighbor, the person from my city, town. The closer to my feet that I buy, that I keep my neighbor employed, they're able to pay their taxes, we're able to have a good school system. I don't like sending my money to unknown locations, whether it be, someplace else in the country or another country.
And I agree with you wholeheartedly. We are a local agency. We're based here out of New Hampshire. I service pretty much all of the state, but I am licensed in multiple other states. So if my clients happen to move to another location, outside of New Hampshire, I can help them out. But I basically cater myself, to the demographic here in New Hampshire. We have a bunch of different ways that you can contact us as well.
You also service some of the housing within the state. I know that I'm in a disability elder housing unit.
Yeah, so what we do is we have actually got a relationship with Manchester Housing Authority, and we go into the buildings with Manchester. We announce that we're going to be doing an educational seminar there, and we do a mailing to every single resident in the building, make them aware of the upcoming seminar. And when they come down, we do just that. We teach them about how this works and explain to them all of the optional benefits that are available to these individuals who are what we refer to as low income subsidy. So people who are on a very fixed income and do not have a lot of additional money to sit there and cover their medical costs. Our objective is to help individuals find the greatest amount of coverage to lessen and lower their out-of-pocket costs when it comes to their medical and prescription drug coverage.
So there are several ways to be able to get a hold of you. People can call you on the phone.
Oh, absolutely. We have, technology is a wonderful thing when it works, and we take full advantage of it. So you can email us at our office. You can also call our office at any point in time. Our office line is actually textable. So you can text our office. You can text me directly. You can also visit our website, that's available and very, very easy to navigate. You'll find all sorts of very helpful information, schedule appointments, look at our seminars that are available, learn more about Medicare right there on the website.
Yeah, I want to say that I had a little difficulty with the dentist with my plan, locating it and billing that I wasn't sure where it came from, and I called your office up. And you have people with various skill sets that have worked within the medical community, and you were able to identify what that was, and it shouldn't have been there, and you corrected that situation for me. And I just want to make people really aware that not only do you advocate for your customers, but you advocate for all customers with the insurance agencies, giving them feedback of what their plans, what people like and don't like about doing business with them.
We do, and your situation was kind of unique because, unfortunately, you had a provider who was, incorrectly charging you, let's just say, for services that you had received. And fortunately for me, that I have someone who is part of our organization who is actually in the dentist industry and knows how the insurance portion of that works, and was able to call them up and correct the situation, explain to them that it was being incorrectly billed. And on that note, you will find that the majority of the time, most of people's issues, when it comes to their Medicare or any insurance policy, is incorrect billing issues, things that are not coded correctly. So it becomes a great concern. People get bills in the mail, they don't believe they're supposed to be getting them, and that's where we tell them, it's like, if this does occur, then you should contact our office and let us know, because that's what we're here for. We're here to help you resolve these issues when you can't resolve them yourselves, and get them corrected so that you're not being charged for something you shouldn't be. And I mean, honestly, I don't care if it's $25 or if it's $2,500. If you don't owe it, you don't owe it, and that's my take on it.
Let's take a break. Okay, Brandon, I got us right about 14 minutes. Do you have the same?
13:57.
Oh, that's .51 on mine. Okay, we're going to talk for a second here, and then we'll come back on. That went pretty good. I was kind of glancing at the clock here, and there was an opportunity to clarify some things that we didn't, that fit into the outline.
Yeah.
So this is a basic outline.
Yeah.
And I thought they fit.
Yeah, that rolled real well. So I like it so far. So I'm just looking at the timing on this. This may actually just time out. Ideally, because it's a half-hour show, right?
Yep.
Yeah. So
I'm thinking. I mean, we've got there's so many ads out there. I'm sure I'm gonna step in with the camera on me first and bring in the ads.
Yeah.
And that way we can go through the advertising, the payments, that don't be deceived. They're not Social Security calling you.
Yeah, that's going to be the next. This is where because we covered that part, so now we're going into the deceptive ad portion.
Yep. And we got, for the second half, we'll start off with this deceptive ad.
Yep.
Options 1 and 2. Donut hole. And then I'm asking Brandon for 8-minute warning up on the screen, please. And I don't think we have anything out. I was happy with the way it went. I'm a little hoarse, not feeling too good. I don't feel that I'm at my full functioning, but it's going good.
Well, I think it's going real, real well. So I think when we get into the deceptive ads parts, that's the thing that's going to keep them in the show for, if it's going to keep them in there, nail that part down right there.
Okay. Well, you sitting there, Brandon?
So on the deceptive ad part, remember, so you're going to turn around, we're going to talk about deceptive ad, I'm going to talk about the TV commercials.
Yep.
And then I'm going to pause for a second, then you're going to go, well, what about that stuff you get in the mail? And then I'm going to nail the mail down, and then you're going to turn around and you're going to say about the
I
phone
got
calls.
calls on my damn phone, too.
Yes.
Okay, so whatever you're talking about, I'll bring up a different one.
Yeah, bring up the next one. So we'll go TV, mail, then robocalls.
Okay. So I just need to hit my stop clock and we're all ready to rock and roll, Brandon?
Yep, whenever you're ready.
Okay. I'm 8-minute warning, please.
Yep.
Well, there's so many ads right now. I every time I turn on the TV set or the internet, I'm seeing, we'll give this money back to you, or you'll save this amount. Well,
Yeah, I like to jokingly refer to those as the Joe Namath ads, and unfortunately, they're extremely misleading. I like to refer to them as deceptively truthful or truthfully deceptive. And to be honest with you, the Medicare enrollment line or the Medicare helpline or the Medicare assist line, these organizations have as much to do with Medicare as FedEx has to do with the federal government. Nothing. They're independent agencies and brokers that are trying to get you to call them and sit there and try to switch you into a plan of their choice. A lot of times I don't like the way these call centers work because they don't take the time to sit there and actually assess the individual need of the beneficiary, the Medicare beneficiary.
so this happens by mail as well. And some of these letters almost look like they're trying to be Social Security or something.
They look so official. I mean, some of them actually look like they're coming from Medicare. So, and that's another thing, too, that you want to keep in mind when you're receiving these mailings in the mail, that Medicare nor Social Security are ever going to call you up or mail you, regarding any new plans in the area, gathering any information that you need to enroll into your Medicare plan, nothing of the sort. These are all solicitations, every single one of them trying to get you to contact an insurance agency, just like myself, that's going to try to enroll you into a plan.
And my phone, my phone comes up ringing stuff all the time.
The robocalls are excessive, if not, borderline harassment, if you ask me, in my opinion. So what I suggest to, individuals, if you have a smartphone and you know how to go onto the Play Store or in the Apple version of it, and review the RoboBlocker apps. They're very effective nowadays. Typically, they only cost $1 or $2 depending on the apps. Read the reviews, see what they say about the apps, because there's many of them out there, and download them to try to give yourself some peace of mind, during this AEP season.
I think the most important point you made there is that Medicare or Social Security is not going to be calling you.
Never. They're never going to
They
call
will
you.
not answer your questions unless you call them.
Exactly. Yeah, so Medicare is never going to call you. Social Security is never going to call you. You're never going to get a mail solicitation from them. You're never going to get an email from them. You're not going to get, especially a phone call from them unless you've initiated that contact and you're waiting for a return phone call. But they're never going to call you out of the clear blue to discuss the new Medicare options that are available in your area.
So I believe we've covered that pretty good. What are these choices that people need to be most concerned about?
So in Medicare, as I explained to you before, and this is part of the presentation that we explain to people when they come to our seminars, is that in Medicare there are two options to choose from. Basically, you have option one and you have option two. Now, option one, Rick, is with original Medicare in Part A and Part B being your primary insurer. In this particular situation, you would pick up a Medicare supplement policy, okay, which would cover the benefits that Part A and Part B do not. Now, Part A covers your hospitalization, okay, yet there is a $1,484 deductible if you get hospitalized. Part B will cover your medical portion of your plan up to 80%. It's then your responsibility to cover the other 20%, and it too has a deductible. This year it's $203. So what a supplement policy does is it will cover all of the costs that original Medicare doesn't cover, for the exception of the $203 deductible, depending on the plan and the carrier that you choose. Now, these are standalone medical plans, and the way these plans work is anywhere they accept original Medicare, they must accept the supplement policy. Now, you'll see that there's a Part D over here as well. Part D is separate. A lot of people are confused and they think that Part D is part of original Medicare. It is not. So when you're looking at Medicare, Medicare only does two things, A and B. This is private insurance, this is private insurance, this is private insurance. A Part D prescription drug plan is regulated, okay, and approved by Medicare, but it is sold by private insurance carriers. Now, option two is a little bit different. These are what the Joe Namath commercials are referring to and explaining to you all about all the time. These are called Medicare Advantage plans. Medicare Advantage plans work like this. They take the Part A and the Part B and they build the Part D into the plan. They roll this into an entire package and they call it Part C, also known as Medicare Advantage plans. That's a synonymous term. Tomato, tomato, it means the exact same thing. There's absolutely no difference. The Part C or Medicare Advantage plans are literally replacement plans. The reason why they call them replacement plans is because when you have them, they replace the original Medicare, so you no longer have it anymore.
Yeah, in fact, my insurance carrier told me to put away my Medicare card and to only use their insurance card.
Exactly. So, and the reason for that is because what Medicare has done is they've taken the premiums you've paid into Part A all your life and the premiums that you've paid into Part B, and they're giving it to that insurance company to manage your health care plan for you. So basically what's happened is they've outsourced it to a private insurance carrier. So
one of the problems people run into this is reference to a donut hole.
yes, the donut hole. So we had talked about this earlier, and I wanted to explain the donut hole in a little bit more detail. So what I've done is I've recorded a clip for you so that you can show people exactly how the donut hole works. So there's a little bit more clarification in how the donut hole works, how it affects people who have some very expensive, high-cost medications.
So it's really important that you understand what your needs are. And this show, this half hour, and working with Bruce, really might not be enough information for you actually to make the best decision. So we do have a show we did last year that was a little more in depth in the specifics and things. This Advantage thing, it's a fairly new thing, and it's becoming more available, more competitive.
Yeah, so Advantage plans in the state of New Hampshire are, we're a little behind. We're a little behind versus our neighboring states. When I get into the business, a few years back, what they call the penetration into the Medicare Advantage arena was literally around 7%. So that means that 7 out of every 100 people had something other than just A, B, and a drug plan. That's up to 19%. So as we are a small populous state, as we have more and more people join these plans, the plans have more benefits. There's more money in the pool, so to speak. So there's more enhancement to the plans that are coming, into the arena, so to speak. This year, some very interesting options. I think next year we're going to see some really big options and some big changes for the benefit of the beneficiary.
So are there more companies competing for the New Hampshire market now as well?
There are. Yeah, you definitely have more people that are competing. There's definitely a big push for the low-income subsidy demographic. People who have Medicaid and or Quimby are a very big target. These are the people who are on very low income, fixed budgets, and don't have a lot of money to spend, that are bringing in these enhanced benefits for them. But before you jump out and grab the phone and call one of the call centers, then you should really sit down with a local agent and find out what's going to be the best option for you and what's going to be the most beneficial for your specific needs in the area.
Yeah, my wife's been a cancer patient since the 90s, so basically my income now is it's less. And I actually have the Medicare and I have Medicaid as well, and it's through something called Quimby. So there's different plans for different financial capabilities.
So when it comes to the state of New Hampshire, we have limited resources when it comes to the Medicaid recipients, and one of the things that are available is called the Medicare Savings Program. So the Medicare Savings Program has basically two components to it. There's 6 parts to it, but the two basic are what they refer to as the SLIMB and the Quimby. The SLIMB is a specified low-income Medicare beneficiary. This is the program that you see touted all the time in the TV commercials, that they're going to give you the money back in your Social Security, and it's because you live in this county or this area or you live in this district. It has absolutely nothing to do with that. They're federal programs, okay? And like all federal programs, there are financial qualifications. So if you fall below the financial qualification, you qualify. If your income is above it, then you do not qualify. It's as simple as that. It has nothing to do about where you live or what county you're in. The Quimby program, it does 2 things. In addition to paying for the Part B, like SLIMB does, it pays the Part B and also pays co-pays and deductibles with all of your medical plans. So as a Quimby, you should have no out-of-pocket costs. And what a lot of people don't realize either is that as a Quimby, under it's a Medicare law, okay, you are not allowed to be balance billed. So what that means that if you have QMB, okay, they cannot bill you for any balances that are due. It's against the law. They either have to send them back up to the Department of Health and Human Services and run it through the Medicaid office, or they have to write it off. It's that simple.
Yeah, what I want to share with you out there is this is one of the areas that is most confusing, because I have an insurance card. I have a Medicare card. I'm covered by Medicaid because of my income, but they do not issue a card. I get my policy, my coverage gets renewed, and I get a printout that says your client number, Medicaid client number is this, and that. Well, the places, the hospitals, the doctors, I don't have a card for it. I tell them I have it, but it never gets billed there. I'm always getting billed for what should have been billed to Medicaid. And that's where your office has been the most help, because I just call you up or someone in your office up and I say, hey, I'm not supposed to be getting billed for this. And and no matter how much I talk to them, it's like, well, we need your card. But they don't give me a card. They give me, here it is. Here's my number.
Right. And that's one of the most difficult parts, is that you find a lot of the billing offices do not understand how to bill it out. And we actually have the PDF on how to bill out Medicaid that we can actually submit to the billing office. We'll call the billing office on the beneficiary's behalf, explain to them that you need to call this number or you need to get in touch with this portion of the agency and get the billing straightened out. Most of the time when you're dealing with these scenarios, they're billing issues is what they are. The plans have good coverage, and the Medicaid system does work if it's correctly billed out and it's done properly.
So we're just about how do people, let's close this up. How do people get in touch with you? You're providing people more resources so you can make the best decision possible.
Well, there's a number of different ways. Like I said before earlier, you can contact our office, our Manchester office. It's 603-273-0951. Our web address is ssa.gov. And also, you can always email us, and you can send those emails directly to me, which is bruce@sbsnh.com. We're we're easy to find. We're on the web. If you actually Google senior benefit services, I believe we're one of the first ones that pop up. And our website has been designed, as I say, it's very simple and easy to navigate. And we welcome any and all questions. I always tell people all the time, there's no such thing as a stupid question.
Your
just one
seminars.
The seminars have been wildly successful. People really appreciate them, and we do them every Wednesday night at 2:00, and Wednesday afternoon at 2:00, and every Thursday night at 6 p.m. at our Manchester location, 400 Harvey Road in Manchester. We're right next to the end of the airport runway off South Willow Street.
Well, I want to thank Bruce for joining us. I want to thank you for watching this show. Be healthy, be safe, and thank you.